Hello and welcome to TechX 2025. My name is Nancy Ost and I'm the director of IEEE at Kapanu, the Honor Society of IEEE. We are really fortunate to have an amazing keynote today on AI and healthcare, transforming tomorrow, today and shaping tomorrow. And we have an amazing speaker with us, Christine Miacci, who has worked for almost 30 years for startups and large corporations. She's the senior software engineering manager at Cloud Plus A division of Microsoft, where she works in the Health and Life Sciences division. She holds 2 degrees from MIT and MS degree in Policy and Engineering and Computer Science and MS in Systems Design. Really, truly a great expert, a really true friend of Etikapanu, and we're really proud to have Christine with us, and we really thank you for sharing your time and your expertise with our audience.
Thank you, Nancy, for that great introduction, and I am honored to be here and present to everybody today my work at Microsoft. So, as Nancy said, I am a senior software engineering manager at Microsoft, and I work in the cloud and AI division, and that division has a number of groups under it. It manages all of Azure, which is the cloud platform on Microsoft. It also manages GitHub, Visual Studio, Dynamic 365, which is an application, a CRM, customer relationship management application. But it also manages all the AI cognitive services on Azure. I am really under the Azure and the AI cognitive services. That's where my group fits in under health and life sciences. And health and life sciences looks at a number of different areas across the board. We look at healthcare solutions, where we provide solutions to healthcare providers to enhance their work. And I'll talk a little bit about that later. We also look at life sciences solutions to enable research and development and boost productivity. There's also, I don't work on this, but there's also research in genomics and also in health equity. Microsoft Research does those areas. So I am in the healthcare and life sciences area. And that's what I'm going to be talking about today, the products and where I think the future is going. So you can go to the next slide now. So in my agenda, I'm going to go back probably to the 90s. And the reason why I'm starting there is because I remember when I had my kids, and I remember very specifically when laptops were introduced into the doctor's office. And I remember I had a pediatrician for my kids that was a little bit older. He was near retirement age, excellent pediatrician, but he really fumbled when he struggled with bringing the laptops into the appointment room. And literally the whole time he would be typing. And he didn't know how to type, so he was pecking. And so it was not a good experience. And unfortunately, it hasn't changed very much today. It depends on where you are. My eye doctor still does not, he has a computer, but he's a younger guy. And they also still use a lot of paper records there. He's actually a little more engaged than the people that just have laptops. My current doctor now, they don't use our software, that's for sure. What she does is she talks to the computer while I'm in the room, and she does things like end of sentence, new paragraph. So it's like very alarming, but she's not looking or talking to me very much at all. So on top of that, doctors, there's just so much more pressure on providers today, any kind of healthcare provider, to do very clear paperwork. And I'll talk about when that started. That also started in the 90s. And when that happened, that was part of when electronic health records started. So there was a real push to bring IT into the medical field. If you remember way back, some of you are old enough, if you remember way back when, there were all these rows and rows of papers and filings when you went into your doctor's or your dentist office. And what happened was, there were a lot of problems with having things on paper. Things got misfiled, lost. They got into the hands of people that shouldn't have them. They weren't disposed properly. And IT, electronic health records, really revolutionized that. And you might hear, you probably in your own doctor's office, you've probably heard of Epic or Cerner or Aetna. Those are the three big medical health records. There's others, but those are the big ones. And my everywhere I go uses Epic, and some of them don't do it at all. Some of them, like my eye doctor, still use paper. So when that happened, there was much more pressure on physicians, on providers to have a very clear medical record. And on top of all the other changes in the healthcare field, burnout is huge today, and it's a crisis, right? All different kinds of medical providers are dropping out of the field because it's way too demanding and the pay isn't what it used to be. So, this is where AI can really come in. So, all of this happened in the 2000s. And then around 2018, I used to work for a company called Nuance, and Nuance was a special. Their specialty was voice recognition. And I remember in the early 2000s, my dentist stopped using medical transcribers. That used to be a field where people, a doctor would record notes and a transcriber would transcribe it into a medical record. And they were specialists. They had to understand medical terms and so on. So my dentist was playing around with Nuance products that actually listened to what he had to say and changed it into a text. Now, that's a commodity today. We all have that on our phones today, right? So that isn't anything new today. It's actually, but back then it was revolutionary. And there were mistakes made. He actually still needed some medical transcribers to help him go through what was actually transcribed from his audio, but it saved him time. So around 2018, AI was good enough that there was a product developed at Nuance called DAX. It was called Dragon Ambient Experience. And the way it worked is there was hardware in the medical office room that would hear the doctor speak, and that would get transcribed into a medical record. And it used AI to do that. And the models were made. It was very labor intensive, but the models were made per provider. So you would start with a base model, and then the provider would start to would start to make appointments, record them, and they would get changed into a medical record, which, just remember, it's not just a straight transcription of what they said. It actually changed it into a medical record that could be put into Cerner or Epic or Aetna, which has very specific fields and required medical terminology and so on. And also it's a certain type of organization. So there was a lot of work to do that. And at the time, we also had medical transcribers that would double check what the AI did. So it was really human assisted AI. And this came out in 2018. It was a huge hit. And most of the doctors that used it loved it. And it just made their work so much easier. The problem was it was way too expensive to run. The cost to create each report, we were charging less than what we could get for that, because it was so intensive, right? Around 2020, large language models came into play, and this was a disruptive technology. And so we were able to quickly pivot and not use medical transcribers or anything anymore. And we were able to train the large language model in medical terminology. And now we have a single model. And this is Dragon Copilot, which you'll see in a moment. And so this has been out since 2023, and it's also a huge, huge hit. And this reduces the cost for the hospitals to have a product like this in-house. And, yeah, yes, it reduces the time and the cost of medical transcribing, but the big thing it does is prevent burnout for providers. That's really the big thing because burnout is such a huge, huge problem right now in the industry. And to have something like this where you have an appointment and everything gets transcribed. It also brings up all the records and synthesize them for you. So it went right before the appointment so that you can then put an updated record and you don't have to write anything. You can review it before you're done, but you don't have to do very much to do that. So this is really huge. And then we're moving into radiology. So radiology is also one of those things. If you've ever seen the way a radiologist works, you may not have seen it. Maybe you've seen it on TV. They usually have three massive screens in front of them, and one has it has the, we're going to see a picture of this later. I won't describe it. It's just a lot of screens and text. And they also have to do very intensive reports for electronic health records. And AI now is with multimodal AI, not only can we do can transcribe the text when they're describing what they're seeing in the image, we can also AI can also analyze the image and assist the radiologist in things that they may not see or vice versa. Actually, they can help train the AI, so it works in conjunction. So I'll be talking about that, and then I'm going to talk about the future. So next slide, please. So I already talked about this. Transcriptions by machines started to replace humans. Electronic medical records required very specific language and formatting, and electronic records replaced paper. These were the key developments that brought us to where we are today to use AI. Next slide. So I want you to think about what your last physical was like. Did the doctor look at you in the eye? Did the did you actually talk to the doctor? Did they you actually have a good conversation, or were they overloaded with all the reporting that they had to do? And then go to the next slide. And then, Amy, you can go ahead and show the video now. So this is the video. Excuse me, just a minute. I'm presenting. All right. So Amy, anyway, as Amy's getting the video up, this is a video of DAX Copilot. And it's a little bit marketing. It's a little bit, has a little bit of marketing flavor, but it's openly, I was using videos that are openly available on the internet. And you can go ahead and show that, Amy, when you're ready. Yes, the video. Yeah, I'm waiting for the video. So while she's trying to bring that up, you'll see in this video actually how this is a real doctor. Like we hire real doctors to use the product and also demo the product.
Well,
There we go. Oh, it was up for a moment. Yeah, it started and then it stopped. So, maybe what I'll
For
do.
over 2 decades, Dragon has been the trusted name in medical speech recognition, empowering healthcare professionals around the world with industry leading voice and AI capabilities. This continues with Microsoft Dragon Copilot, your AI assistant for clinical workflow. Part of Microsoft Cloud for Healthcare, it's an extensible workspace that brings together natural language and ambient speech capabilities with fine-tuned generative AI and provides a consistent experience, whether mobile, web, desktop, or through leading EHRs. With a modern architecture, enhanced security, and healthcare-specific safeguards, it's anchored in Microsoft's approach to trustworthy AI. Dragon is accessible across specialties and care settings and transforms the way clinicians work. And it all begins by streamlining documentation with new levels of customization. From ambient note creation and natural language dictation to custom texts, templates, and AI prompts, Copilot gives you control over how documentation gets done. It also lets you surface information without leaving your workflow, from querying notes and getting medical information to receiving encounter recording suggestions. Copilot gives you access to pertinent information when you need it most. And with an integration to Microsoft Fabric, healthcare organizations can unlock insights at scale by tapping into point-of-care data. Beyond that, it lets you automate tasks with a single click, from summarizing evidence to prepping orders, drafting referral letters, and after-visit summaries. Copilot saves time. Dragon Copilot takes clinical productivity to new heights so you can do more. To promote clinician well-being, increase operational efficiency, improve the patient experience, and drive meaningful financial impact. Do more with Dragon.
Excellent, thank you. Yeah, so you can see in that particular video, that it's not just listening to what happened in the office and making a medical record. There's all kinds of things. There's ways to add notes. There's using Microsoft Copilot, prompting you to do a knee exam. Like, what do you have to do? If you know all the different things you should be doing in a knee exam, summarizing past notes so that you don't have to read through all the notes. And so there's a lot of pieces of productivity to this product now, and it keeps growing. The other thing, I don't know if you caught that, but they talked about how they integrated in with other specialties. So the models that are used for each of these physicians, there's specialties, like there's knee and there's heart and there's cancer and so forth, and different types of cancer. And the models are different for all of those. And Microsoft doesn't have all those models. So the physician, the hospitals can bring in models from almost anywhere and determine how they're tested and how reliable they are. So that is where we are today. And it really is causing a big splash in the industry and doing very well. So can you go to the next slide now? So you actually don't have to bring out the next slide. You can just show the next video. So I want you to watch this next video. This is more on how to use Copilot within radiology, and it's only a few minutes long. And what it shows while they're bringing up the video, the next video, what it shows is I want you to think about how you could use some of the solutions they're showing in this video in your own work, because all of us do research, all of us do work take notes. We read things and take notes almost no matter what you do. And we all need to retain that and summarize it. And this is where these AI assistants can be really powerful. And this next video is a post from Satya Nadella after he went to the show RSNA, which is it is the main radiology show of the in the United States for radiology professionals, and it has all kinds of technology and products and so forth. And we had a show this year, it's always in December, and Satya Nadella went there and saw some of the demos and posted this on his LinkedIn profile. And that's the video you're going to see right now. But think of this as also how you could use some of this technology. And whenever you're ready to show the video, we'll be there. Yeah, there we go. Good. Yep, go ahead.
In charge of organizing Tumor Board Conference for the month. And I'm going to start off by leveraging Copilot within Microsoft Word to create an agenda. I'm going to ask it to generate an agenda for Tumor Board based on a particular file that contains the cases and participants, include time slots for each case discussion and a section for Q&A, make sure to allocate extra time for complex cases, and include a brief introduction and conclusion, and do it off of this file. So I'm going to ask Copilot to run this. And within a matter of seconds, it's able to come up with a comprehensive agenda. It lists all of the participants. It has all of the difficult cases that I wanted, the pan-post tumor, the large BAC in the setting of COPD, the non-small cell lung cancer abutting the esophagus, the Q&A session, and the conclusion. Now, this is just a draft. I can edit this, add things to it, delete things if I don't want them. But I think that this looks pretty good. So I'm going to keep it and I'm going to forward it to the members of the multidisciplinary team so that they can prepare for conference. Now, using Copilot within Microsoft Teams can really enhance your experience. So here at Tumor Board, we have Copilot running. And what I love about it is that I can just focus on the conversation. I don't need to take manual notes for this because Copilot's doing that for me. If I get distracted or if I can't hear something, I can simply ask Copilot a question and I'm confident that it will give me an accurate response based on the meeting context. I also have a number of capabilities built in that I can ask Copilot to do. But as I'm thinking about it, I think that this would be great information to present to the medical students. So I'm going to ask Copilot to generate some meeting notes for me. Now, as we wrap up Tumor Board, I can go ahead and access and review those notes that Copilot generated right here within Teams. And it has all of those cases listed, the presenting symptoms, the treatment plan, the possible side effects for each treatment option. So I can take this and put it into a Word document and use it as a teaching file. So I'm just going to paste this into Word. And then I've created my teaching file, and that's what I'm going to base my presentation off of. And I'm going to create this again using Copilot within PowerPoint. Now I have a number of capabilities I can choose from, but I'm going to create a presentation from a file, and it's going to be those Tumor Board notes. Copilot's going to be fast at work, working on a response for me, and it's created an outline. And now it's going to go ahead and draft my presentation. And you can see that this is a really comprehensive presentation. But again, it's just a draft. I can add to it, edit, delete things if I don't want. But I want all of you to just imagine how long it would take you to generate this from scratch with the content and the design. Copilot is a truly transformative tool that can improve your efficiency throughout the day.
Thanks, Amy. So you can see that this is not using any special tool. It's using Microsoft 365, which many of us have. Many of us have on our desktop. Maybe you don't use it, but you might have something very similar in another tool set. I think Google has a similar tool set. I'm most familiar, of course, with the Microsoft tool set. But you can see, imagine having a meeting and trying to generate the agenda based on, like, for instance, I've used this to generate agenda and it goes through all my Teams chats and will able to generate it for me. And what she was showing, this is a doctor that works for Microsoft, and she was showing a tumor board. A tumor board is a group of radiologists that get together and evaluate a radiology report, which includes text and images. And what you saw on the screen was a DICOM image. We'll talk about that in a minute. And so anyway, you can see how it just increases the productivity, that she didn't have to take notes. Just think of yourself when you have to take notes. If you have to take notes and run a meeting, it's almost impossible. But now you could with these tools, because the tool is taking the notes for you. And it will probably take you a few times to actually trust the note taking. You're going to have to maybe take some notes by yourself and then see how the notes turn out and see if you trust it, and you'll build that trust in the system. So you can see it's being used in the medical field. It can be used anywhere. And I'm just pointing out that these tools are available to all of us today. So the next slide. Yeah, can you show the next slide, please? Because I want to show you this. I talked earlier about what how a radiologist works. And a radiologist works 10-hour days with 3 massive screens, and they're constantly looking between the screens. Most of them do use some form of dictation and transcription. Almost no one types in their notes anymore. Yeah, just go to the slide with the medical image on it. I think it might be slide 7, if I'm correct. Next one. Yeah, I think it's the next one. Yeah, that one. Thank you. So this is squished down, but on the total right side, it's blurry, but you would see previous reports. And then in the center, it's actually taking transcribing your voice into what you're seeing in the image here. And then you can see all the different images on the left, and some of those are from different times, different angles, months ago, weeks ago, and they're analyzing it. Now, these images are they're what are called DICOM images, and they're slices. So it's like getting a sliced image, a 2D image from the body. And I don't know if you've ever worked with a doctor on this, but sometimes you look at this and they're saying, well, there's a tumor here, or you have a break here. Usually I can't see it. I can't see it. Even with ultrasounds with my kids, like they'll say, oh yeah, this is a leg here. I can vaguely see it, but sometimes I can't see it. Now the imaging is getting better with ultrasounds, I have to say. But this is really hard for a layperson to interpret. Radiologists can read this very, very well. They're very good at it. These electronic tools also allow you to annotate these images. And what AI will do is AI will analyze these images down to the level of the pixel. And research has shown that AI can find tumors in images before humans can see them in these images, because they go right down to the pixel. Now, AI can still make mistakes. Humans can make mistakes. And the interaction between the two actually is a field of research that is just emerging right now, where this is really human assisted AI still. And you don't want to always just blindly trust the AI, because the AI still can be wrong, but the AI also can guide you to things that you would miss. And we have to always constantly train the AI from what we tell it as well. So there's all kinds of ways in this application to summarize past reviews of this patient, and all over also on whole what is going on with this patient. A lot of data about a single patient in here, and I'll talk to you about that in a bit. So this is where we're going. We have Dragon Copilot. The industry is starting to move into imaging and multimodal AI, and all of it is around to help the provider to prevent burnout, to be more productive, But burnout really is one of the biggest things, so that you reduce the load on the physician, so the physician does not have to do so many things. They can focus on patient care, which is why they're a provider in the first place, right? Let me see. There was one more thing I wanted to say about this. I think maybe it'll come back. But all right, so let's go to the next slide here. Just go, yeah, thanks. So will we ever be able to get rid of doctors? Will AI replace doctors? I don't think so. I really truly don't think we will ever replace doctors, but I do think we will improve our care greatly when as AI continues to improve, and I think that that will be a great thing for all of us. So as that happens, I already see a big improvement. An example, if you've had imaging done over the years, you're getting back the results from your imaging quite a bit quicker than what you used to. And so, like, usually, sometimes it's like just a day, or it's even the day that you had the imaging. I recently had a DEXA scan for osteoporosis, and it came back. Now, that's different from this scanning, but it still has to be read by a specialist. But I don't think it's going to replace providers. What I do think is that we as patients, I think the future is we're going to be able to manage our own healthcare in a way stronger and more expert way. So right now, there's always those people. I have relatives like this. They completely defer to the doctor. Anything the doctor says must be right, and they don't question it. And you really do have to question and take control of what is happening in your own healthcare, and sometimes your family members that are dependent on you. So, what I think AI is going to do in the future is we're going to be able to work with our providers in a more equal way, because we're going to have way more knowledge from what AI will give us than what we have today. And I think that the next wave of applications, and not necessarily at Microsoft, but maybe with startups or with other companies, and maybe at Microsoft, I don't know, is that these are going to be patient-centered applications. And one of the ways that this is going to happen is we are going to become way more aware of our own data and where it is going. So I mentioned earlier, that's a lot of data in that radiology frame that you saw, all about you, if that was your radiology report. And I haven't been that aware of all that data. And for instance, let me ask you this, and just answer it yourself. Do you know where all your health records are from the moment you were born? I certainly don't. I don't even think my kids don't. My kids don't have all their healthcare records. They have some of them, but some of them have been lost to, for instance, my son, this is just recently too, a hospital went bankrupt that we were at, where all his records were, and it got bought by another hospital, and he hadn't been there in about 5 years, and we couldn't find his records. We did find some of them, but not all of them. So all kinds of things can happen as hospitals as things change. I've had many, many doctors over the years. I don't have any of my records. One thing that probably will happen, apps will help you gather your records. So these electronic health records systems that I mentioned earlier, Cerner and Epic, at any time you can contact them, and they're supposed to be able to give you all your records that they have on you. And there is even APIs that you can automate that. So I think the new wave of apps, and I have a final video I'll show on this, is that you will be able to get all your data, control all your data. And the one thing you'll also be able do is once you have all your data, you will be able to get AI to help you analyze what your current health issues are and what you might be at risk on. So this does not happen today, but it's possible because we're already doing it for doctors, right? You already saw how Copilot was able to summarize things, and you saw that in Dragon Copilot as well. So these are things that could be for the patient as well. And a lot of those records you wouldn't be able to understand either because they're using medical terminology, and AI would be able to translate it into something that you could understand. So I worked on an app at Microsoft. We have this really great thing internally called the hackathon. And I got a group of phenomenal engineers together. And we created an app that actually did this. And it also, and it automated all of this. And it wasn't a fully developed app, but we developed prototypes in different areas. The other thing that we did is we interfaced with a drug database, which is provided by the FDA for harmful drug interactions. And so we were able to look at, and we did a prototype of that. This app is also really useful for transitioning to new providers. So how many times have you gone into the doctor's office and you have to fill out all pages and pages for a new provider of information that you may not even know, like what's your what is your cholesterol levels, what is your current blood pressure? You don't know, and you could get that. And this, even dental records, right? And this app would automatically fill those those forms out for you. And then you could check them over. And so that would save you, it would just be way more accurate for your new provider. And on top of it, this is very useful for if you had, for instance, a parent that you were taking care of, and they had different caregivers in and out. This would actually give the caregiver coming in a summary of what's going on with that person. So I really think the next stage of healthcare apps are going to be for the patient, not so much for the provider. And people have asked me, well, it's really expensive to use AI. Can this actually make money? And it can, because there's a huge demand for this. Anyone that goes to the doctor would and could use this. I really see it as an application for families, for a particular maybe a particular lead. And there's always a family always has a lead, maybe two, but usually one that leads all the medical information of, that takes care of everybody's appointments. And it's both for, older relatives and your children and anyone else that you're taking care of. So I see this as per household, and I think there's 127 million families in the US alone today. So just in the US, this could be huge. So we did do, I will let Nancy go ahead and show the video on this one now, and you'll see this is what we developed during the hackathon. So Nancy, whenever you're ready, you can show the video.
IEEE-HKN empowers you to take control of your medical information and make informed decisions by offering valuable insights. It collects all your records and allows you to access them and other health data securely. Here are the problems IEEE-HKN can help with.
As a patient, it's always a struggle to access my personal medical records, especially when seeing a new doctor who doesn't have my history. I've moved all over the country and travel a lot. It would be amazing to have an app that keeps all my medical records in one place.
I often get prescriptions from different doctors, and it's challenging to know if these medications could negatively interact with each other.
I have 3 children and need to keep track of all their medical issues and prescriptions. We often go to new doctors and I don't have the information I need.
I'm in my doctor's office filling out new forms. When was my last annual visit or dental checkup? What was my last cholesterol readings?
The digital health market is growing rapidly at 19% per year. The mobile healthcare market is valued at $17 billion and is growing double that rate. APath is an app that is valuable to every family that visits a doctor, and there are 127 million households in the US.
APath can store all your medical records securely in one place. Our app uses AI to analyze your medical records and gain insights on health. It keeps track of your appointments and records your visit to get a summary. Using APath, you can manually scan or upload your medical records, either text documents or images. You can capture and accept an image, add a memo, and save it. You can see all your records, including ones imported from different patient portals like Epic MyChart and different EHRs such as Cerner or Athena. You can use Copilot to search your records in a smart fashion. Once you have a set of medical records, you can do various analysis tasks. Multimodal AI is used to analyze entire medical record sets, create summaries. It relies on GPT-4o and advanced medical science databases to analyze both text and images. Summaries can be used to transfer information to new caregivers. Based on our analysis, we can utilize existing databases like OpenFDA to identify and inform users about potential harmful interactions between their entered over-the-counter medications. APath allows recording a physician visit or telehealth call, and it will create a summary for the patient. Using text analytics, it creates structured data and can find patterns across many physician visits. OpenAI can be used to ask open-ended questions on this dataset. APath will start as free with a small amount of storage available. Users will purchase storage as usage increases and also pay for premium features such for AI analysis, form generation, and drug interaction.
Yeah, so, it is amazing. We did that last September, I think, and already there are models that are way more powerful than what we used. And we used Copilot in a similar way that you saw in some of the videos today to do this. We also used, we brought in data to augment the current LLMs that we were using. And so, yeah, it was just a playground playing around with everything that Azure had to offer, and we used all of it. So we did do a prototype of the app the prototype won an award in the hackathon. The hackathon had like over, I think, like 30,000 entries in it, and we won a local award in the New England office. So yeah, it was great, and we had a great group of people working on it, and it was a lot of fun. So I really do think that's where the future is for us, that we're going to be able to get the information that we need about our own health and our family's health and work with providers and maybe see things that they don't see, or give them information that they don't have, because we're going to be the ones with the complete information. The doctors today probably don't even have that about us. So that's where I think we're headed. Oh, and one other thing, all the wearables that we wear today, all that data will also be going into APath, because there's APIs to get that data. And you can imagine having that daily data from, I have a Garmin watch that collects all kinds of things, sleep and heart rate and all kinds of things, steps, that would be in there for you. And most of us are wearing these kind of devices today. Doctors don't have access to that, but we could give them that if it was useful. So the one final thing I want to mention is that this data, it will be securely stored on Azure. Azure has many offerings for storing your data in a very secure way, and that's really important. And you also have the ability to delete it as well, which is important, and set deletion policies if you ever want to do that for permanent deletion. So that's another really important thing, and that so that other people won't have access to it unless you allow it. So that's where I think we're going, and I wanted to take any questions from the audience.
Well, thanks, Christine. This has been super fascinating. I was actually at the doctor yesterday. So I actually had to go for a follow-up appointment yesterday. And I always, I'm amazed anymore. And they use Epic. He uses Epic. That he spends more time talking to the computer than he does talking to me. So I did notice that.
Yeah.
And I've always, I guess I have trouble remember my password to get back into my chart all the time. So like, hopefully there'll be some kind of other
Yeah,
recognition.
my chart. People were saying that this new products is a competitor to my chart, and it is. But my chart just stores records, right?
Mhm.
And they're not in your control. They're in
Not at
Epic. You
all.
have to,
No, I really
yeah,
like
you
what
have
you
to
were
remember
talking about.
that.
Yeah, really
Yeah,
talking about being able to delete and the security of keeping it. Because again, I do also wear an iWatch, so I like to look at my sleep data and everything else. But and it's just great. I'd love to have someone analyze it. On the other hand, I wouldn't like somebody else to use it and say, "Well, I don't know if we're going to offer Nancy insurance, or maybe she's in a higher risk pool because I took
exactly.
less steps this
You
year."
don't want to throw all this in Epic. You also have the ability to add your own notes to it, but it's your data. It's your
Mhm,
data to control and
mhm.
protect, and you have the ability to protect it. Yeah.
So, like, a couple of questions in here. One about Copilot. Does it work with other software tools? You used it with Teams, which is interesting, and I've been seeing all this other stuff I think I can do. I go, wow, I could increase my productivity here. So there's a question about Copilot. What else it
Yeah,
works with?
I mean, it's when I use it, and I have Microsoft 365 with my home. So it's not the one that I use at work. The one that we use at work, I think, has like the latest models, but
Mhm,
the one at home is still very good. So the one I have at home has just a plain Copilot app on my PC.
mhm.
And then you can also use it. It's inside, there's an icon inside all your apps, Excel and then it's very similar to, we also use GitHub Copilot for writing
Yeah.
code because
Mhm.
that's what we do. So that this icon is in all the apps, and you can highlight a particular piece of text, or you can chat with it, or you can ask it to do research, but it's usually part of all the apps. It is part of all the apps.
Yeah, no, I think there's a lot of tools we have to all go play with. I think we've learned all kinds of
It
stuff.
it is. It's a lot of fun. Yeah,
A
it
lot of new
is.
tools and things that you play with. So someone asked about Microsoft Azure and Google Cloud and AWS. Which one is better to use? I guess it's just your opinion. I don't know.
I mean, I can't speak.
You
I
don't use
haven't
all the
used
other
Google.
ones, so.
Yeah, I don't use Google Cloud professionally.
Mm,
Do use Google Tools, and
mm.
I haven't really played around with it.
Yeah, there was
Um,
one of our speakers during one of these sessions gave us a list. I thought, my goodness, it's a huge list to go through. So thank goodness the slides are available in the resource section. So if you
Right.
say yes,
Yeah. I
your
mean,
slides
a
are
lot, there is a lot online on comparing the tools
mhm,
too.
mhm,
As you know, they're working, they're very competitive, and they're working at breakneck speeds to
mhm.
try to get better and better and beat each other out. And it's
Sure.
moving it very quickly. And like I said, the models that I used on that app in the fall have all been massively upgraded, especially the multimodal AI with images.
Mhm.
That's really been upgraded. So, yeah, I don't know the answer to that though, but there's definitely stuff online for it. Yeah.
Sure. So,
Microsoft is better. Is yours better?
of course it is because
Yeah.
we know where you're coming from on this.
Yeah.
Do you think there's gonna be an over-reliance? I think there's a couple of questions about this, over-reliance on AI, um, in terms of radiologists or surgeons or things like that. Do you think there'll be an over-reliance on that, not enough reliance on maybe what doctors themselves do?
Um, I don't know, because I would say the medical field is very hesitant. They're usually technology shy, and because
Mhm,
they've been burned. Like when going over to the IT, they've had like records law. I talked about paper records and all the problems with that. There's a lot of problems with electronic records too, and
mhm. Oh,
they
yeah, I
weren't
remember.
properly
I mean,
protected. Yeah. And so
exactly.
there's a they and they've all and systems go down, cloud
Mm,
systems go down. So the medical industry is very skeptical, and they're usually slow to adopt.
mhm,
But so there's that. But also I think that we should not overly rely on AI. I think we should always and actually there is some research that can happen. You could
mhm,
just say, "Oh, I'm the one that's wrong and the AI is always right." No, that's not true. The
mhm.
AI can be wrong. You have to use it as, even if it was a personal assistant, what they're giving you might not be right. That's how you have to look at it.
So
I
maybe
don't
just
believe Yeah, you always have to take it with a grain of salt. I
mhm,
don't think that AI will replace radiology. I don't think it will replace doctors or providers. Yeah.
Well, I hope not. I mean, I was in a robotics lab actually in Budapest earlier this week, and watching how they do robotic surgery. It's very interesting, but at least at the center of that, there still is a doctor, and then there's all this other data supporting it. Um,
Yeah,
and
that's good. Thank God. I wouldn't want to be
thank God, I would
operated on by a
just a bot,
robot with no.
just a robot and nobody
I
else.
we
Nobody
saw
else.
self-driving cars
Uh-huh.
at in Austin at South by Southwest, and I would not go in one. I was too. They
Well, I
were
think
really they were really there. I mean, I feel like I'm very old not doing that. I
no,
know they're
no.
coming, but I was like, I am not going in one.
No, I was let us to talk about 6G, and I think until 6G comes out and there's more sensors out there and things, maybe it's
Yeah,
that goes
maybe
also.
that's what it is. Yeah, that's
Maybe,
good.
maybe. So there's so much going on. Things are happening so rapidly fast. We really appreciate your sharing some of your background and expertise and your experience with these tools
Yeah, I
and
really
demonstrating
enjoyed
it
it.
so much for us so that we can actually see it in progress and in work and awesome on the app.
Yeah, it was Waymo's that I did see, by
Mhm.
the way.
Yeah,
It was Waymo.
pretty
Yeah,
cool.
anyway,
Yeah.
yeah, thank you for the opportunity. I really
Mhm.
enjoyed this,
Yeah, we
and
appreciate
great to be here. Yeah.
we appreciate future directions for sponsoring this, and we appreciate really bringing cutting this leading edge information to our audience today. Take care.
Yeah, you're welcome. Thank you, Nancy. Take care.